and thank you for taking the time to listen to this presentation about your employee benefits package through Howard Fertilizer and Chemical. My name is Sarah and I represent Brown & Brown Insurance, which is the broker that manages your employee benefits. Today we'll be reviewing your employee benefits guide for the plan year that runs from July 1st, 2020 through June 30th of 2021. On page 2 of the guide, there's a table of contents, and in the top right-hand side of this page, it lets you know that there is a notice pertaining to Medicare in the back of the guide. If you're of Medicare age or approaching Medicare age, just make sure that you take a look at that notice and then you notify HR if you have any questions about your options. Page 3 of the guide discusses eligibility for benefits, qualifying events, and how to enroll in your benefits. Starting with the top of the page, that's where it lets you know that United Healthcare will continue to be our carrier for medical, dental, and vision. We'll also be staying with Mutual of Omaha for life and disability, and Aflac for voluntary products. So let's talk for a moment about who is eligible for coverage. If you're working at least 30 hours per week, you're considered a full-time employee and you're eligible for the benefits in this guide. If you choose to enroll in benefits, you can enroll your eligible dependents as well. Eligible dependents include your legal spouse and legal children as defined in this section on the left-hand side of the page. Keep in mind if you cover your dependent children on any of your policies, there are certain ages at which they're ineligible to continue on your plan. You can find the exact ages and restrictions on this page in this section. Once they become ineligible, they won't be automatically dropped from your plan. So it is your responsibility to notify HR in that case so the dependent can be removed and you're not paying for coverage that doesn't exist. Open enrollment is the one time during the year where you can make changes to your benefits, no questions asked. So during open enrollment, you can add or drop dependents, you can cancel coverage, or make whatever other changes you want to on your plans. Outside of open enrollment, however, you have to experience a qualifying life event in order to make a change. So the right-hand side of this page gives some information about qualifying life events, including some examples. Life events include things like marriage, divorce, having a baby, your spouse losing coverage under his or her employer's benefits. Those are all qualifying events, so you could make a change to your benefits mid-year if you experience something like that. The key here, though, is you have a 30-day window to make any changes. What that means is you have to let your HR team know that you've experienced a qualifying event within the 30 days after the event takes place, or else you won't be able to make changes and you'll have to wait until the next open enrollment period to make changes. The last section on this page talks a little bit about how to enroll in your benefits. Now this is what we call a passive open enrollment. So that means that you only have to log on to Employee Navigator if you want to make changes to your benefits. If you want to keep all of your benefit elections the same, you don't need to take any action during open enrollment. However, I will say that it's best practice no matter what type of enrollment is taking place that you log in to make sure you're enrolled in the plans that you think you are and that you're covering the dependents that you think you are. Also, it's best to verify that you have the correct personal information listed in the system for yourself and any dependents that you cover on your plans. If you're enrolling a dependent for the first time, please do make sure to have your dependent's birth date and social security number on hand as you're enrolling because it is required by the carriers. Over the next few pages are the step-by-step instructions for Employee Navigator. If this is your first time logging on, you will need the company identifier that's listed on this page. So it is a good idea to keep this benefit guide on hand when you enroll so you can reference that. Once you're logged in, you'll click Start Enrollment and follow through the steps. You'll go through each of the benefits one by one to make your elections. Please make sure you take the time to indicate your beneficiaries for the basic life insurance policy if you've not done so already, or take the time to update them if you need to. Even if you're not electing any voluntary life insurance coverage or any coverage on any of the other benefits, the basic policy is paid for by your employer. So all employees are automatically enrolled in this, and we need to know where you would want the benefit to go if you were to pass away. If you run into any issues or have any questions while you're enrolling, you can contact Trish Lay at Brown & Brown by calling the phone number on this page. Your employer will continue to offer 3 medical plans through United Healthcare. These plans are outlined on page 8 of your guide. The first thing I want to note is that the plan names have changed this year. As you're looking over the plans and you're determining which one is right for you and your loved ones, maybe for the first time or maybe you've been enrolled in the plans and you just want to take this opportunity to make sure you're enrolled in the right plan for you, there are a few things that we suggest that you focus on. The first thing is going to be the out-of-pocket maximum. That's listed on the table about 5 rows down. It's grayed out. This is the most you'll be responsible for paying should you need to use the plan. So that includes all of your copays, your deductible, and prescriptions. Once you reach your out-of-pocket maximum, United Healthcare is going to pick up 100% of the rest of your medical and prescription claims through the end of that policy year. There's an individual and family out-of-pocket maximum on each plan. Plan 1, the individual out-of-pocket maximum is $4,000. The family out-of-pocket is $8,000. Plan 2, it's a $6,000 individual with a $12,000 family. And then Plan 3 has a $2,500 individual out-of-pocket and a family out-of-pocket of $5,000. The out-of-pocket maximum is your worst case scenario when it comes to your medical claims. So you know that that's the most that you'll pay during the policy year on your covered in-network medical expenses. Being that the plan runs on a policy year, your deductible and your out-of-pocket maximum resets every year on July 1st, so just keep that in mind. So the second thing I want you to think about is going to be the weekly payroll deductions. Obviously, it makes sense to think about how much we'll be paying out of our paycheck each week to be enrolled in one of these medical plans. So the plans here on the page are listed from lowest cost to highest cost. One thing that your employer has really prioritized for many years is being able to offer employee-only medical coverage for $1 per week. Now, given the landscape of the healthcare industry at this time, all employers are being forced to reevaluate their benefit packages. Healthcare costs are rising year after year, so ultimately your employer did make the decision to increase the payroll deductions for all coverage levels through all plans. That includes changing the deductions from $1 to $5 per week under the first two plans, under employee-only coverage. Just to be clear though, your employer is still very much prioritizing the ability to be able to offer comprehensive coverage at a low cost. It may seem like a big change, but compared to the market and other similar organizations, your payroll deductions are still very, very low. Also, remember that if you're on the first plan and you're enrolled in an HSA, your employer is also going to contribute to that HSA every year. That by itself is a great benefit. One of the things I like to do when I'm evaluating medical plans is I like to look at how much the plans will cost throughout the entire plan year, so that's the payroll deductions, and then evaluate my total exposure by factoring in the out-of-pocket maximum. So for example, let's look at the first two plans, and let's say you're only covering yourself on medical. So both plans will cost you $5 per week to be enrolled in. Multiplied by 52 weeks, that comes out to $260 over the course of the year. If we add that amount to the individual out-of-pocket max on each of the plans, what we'll find is that the first plan has a total exposure of $4,260, and the second has a total exposure of $6,260. So if I enroll in the second plan, my total exposure is actually $2,000 more than on the first plan. So why might I do that? Well, one reason might be because I prefer a copay plan versus an HSA plan. Maybe I'm okay with my out-of-pocket maximum, my potential exposure being higher because I like the security of knowing that if I go to a primary care doctor, I'll pay a $25 copay rather than the contracted rate like under the HSA plan. So the third thing you need to consider is utilization. How are you going to use that plan? Part of that is understanding the differences between the plan design under each plan. The first plan, as I said, is an HSA plan, also known as a high deductible health plan. Under a high deductible health plan or HSA plan, you won't have copays until you reach the deductible. Prior to reaching the deductible, you'll pay the contracted rate that UHC has with any in-network providers for all medical services and all prescriptions. For example, if you go see a primary care doctor, on average that would cost you between $100 to $150 for that contracted rate. Obviously, that's significantly more than, let's compare it to the $25 copay that you would pay on the second plan and the $15 copay that you would pay on the third plan. So by enrolling in the first plan, you're understanding that at the point of service, you're going to pay a little bit more, but your overall exposure as compared to the second plan is actually $2,000 less. Once you reach the deductible, it switches to a cost share where you pay 10% of your claims and UHC pays 90% for any medical claims, and you start paying copays for your prescriptions. Remember though, once you reach the out-of-pocket maximum under any of the plans, UHC will cover 100% of your claims through the end of the plan year. One of the biggest benefits to being on this first plan is that you have the opportunity to enroll in the HSA, which I mentioned, but we'll discuss more on the next page. Another aspect of utilization is understanding that the plans have different networks of hospitals and doctors. The first two plans offer coverage in the United Healthcare Choice Network, and you're limited to only in-network coverage under those plans. Now on the third plan, the network is Choice Plus. You also have out-of-network coverage under the third plan, so if you do go out-of-network for your services, a portion of the claims will still be applied toward your out-of-network deductible, whereas on the first two plans, there's no out-of-network coverage whatsoever. However, we do encourage that you stay in-network to keep your costs down overall. Page 9 of your guide gives some information about health savings accounts, or HSAs. An HSA is an IRS-regulated bank account that you can open and contribute to using your pre-tax dollars from your paycheck. Now, you can only open an HSA if you're enrolled in the HSA medical plan. Any money that you contribute from your paycheck is done so on a pre-tax basis, meaning you're not paying taxes on any money that you're putting into this account. And as long as you spend the money in the account on qualified medical, dental, and vision expenses, the money will never see taxes. Not only that, but if you enroll in the HSA plan, your employer will contribute to your HSA on your behalf, even if you're not making your own HSA contributions. That means you get free money from your employer for being enrolled in that plan. You can spend that money on your medical, dental, and vision expenses. So this is a great benefit. Not all employers that offer an HSA plan provide such a generous HSA contribution. Many don't offer one at all. So this is a great way to put aside pre-tax money for your future medical expenses. Now, you do have the option of using it right away, but if you decide to save the money in your HSA, it rolls over from year to year. So you don't have to worry about spending it by a certain date or anything like that. There are some eligibility requirements that you should be aware of. They're listed on this page in the section titled Who is Eligible for an HSA. If you're enrolled in any part of Medicare or receiving Social Security benefits, you cannot contribute to an HSA. Keep in mind that means that you can continue to spend the money in an HSA on eligible expenses, you just can't contribute to it anymore. The right-hand side of this page gives a few examples of eligible and ineligible expenses. Again, this is an IRS-regulated account, so they're not going to allow you to spend this pre-tax money on what they deem to be ineligible. The most common eligible expense is your deductible. So when you're visiting your primary care doctor or you're filling a prescription, you can use the money from your HSA to pay that expense. You can also spend the money on eligible expenses for your tax-eligible dependents, even if they're not enrolled in your medical, dental, or vision plan. Keep in mind the IRS limits how much you can contribute into your HSA. These contribution limits are listed in the table at the bottom left-hand side of the page. Now, the limits that are listed there include all contributions to your HSA, so both yours and any contributions from your employer. So just make sure you're keeping that in mind. If you do want to contribute to your HSA and you want to max that contribution limit out, make sure that you're accounting for the contribution that you'll receive from your employer. If you're a new employee enrolling in the HSA plan and the HSA for the first time, just understand that you have to take an additional step past just selecting the plan in Employee Navigator in order to receive the HSA contribution. You have to set up your HSA on the Optum Bank website before Howard can make that contribution into your account. So that's really important. We've included that where it says next step in the bottom right-hand side of the page. It has the website for enrolling in the HSA as well as the group number you'll need to set up your account. All of that information is listed in this section. Page 10 of your guide talks about United Healthcare's website and app, which are great resources for information relating to your medical plan. Once you're enrolled in medical coverage, you can register for your member account on either the website or the mobile app. And when you're logged in, you can view a ton of information like your claims history, you can search for a local in-network provider or pharmacy, and you can pull up your digital member ID card straight from the app or website. UHC also has a tool that allows you to compare the cost of different types of treatments and medical services at in-network providers in your area. So especially if you're on that HSA plan, you can go on there and actually compare the contracted rates of services from one in-network provider to the next. So really, really helpful, great way to help you make smart decisions about your medical care. The top of the next page gives some information about UHC's premium designation program. So this has to do with how UHC rates their in-network providers and what to look for when you're searching for a provider. UHC also has an Employee Assistance Program, or EAP, which is available to all of its members at no cost to the member. The EAP professionals through United Healthcare can assist you and your dependents with a variety of different types of challenges that you might be facing. from mental health to legal and financial challenges. This is a completely confidential service, and it can be exactly what you might need if you're facing a challenge and you don't know where to start with getting help. Advocate for Me is the last section on this page. So anytime you need help understanding something related to your medical plan, you can reach out to the support team. They're really there to provide personalized assistance, which helps you navigate your medical and pharmacy benefits. The next page lists some additional member benefits under the United Healthcare medical plans. Both of these are free to participate if you're enrolled in the medical plan. Rally is United Healthcare's way of gamifying wellness, so you can access the website by logging into your UHC account, and then you'll have access to a ton of different healthcare challenges to participate in. So you earn points by participating, and then you can use those points toward health and wellness related items. Real Appeal is UHC's weight management program. If you qualify with a certain BMI, you can participate at no cost to you. You'll get a personal transformation coach who you'll meet with online every week. You'll also get UHC's Success Kit, which includes great fitness items such as workout DVDs, a personal scale, and a food scale. These programs are definitely worth looking into if you're enrolled in the medical plan because, as I said, they're free to participate in. Once you're enrolled in the medical plan, you'll have access to virtual visits through Teladoc, Amwell, and Doctor on Demand. A virtual visit is a video conference with a U.S. board-certified physician. What that means is when you're sick, instead of visiting an urgent care or a minute clinic or some other type of care, you can video chat with a doctor from your phone or computer, and the doctor has the ability to prescribe medications to a pharmacy of your choice. Virtual visits are super convenient, especially when you're traveling or when you're at work, not feeling well, and maybe you think you need a simple prescription sent to your pharmacy to make you feel better. A lot of low-grade medical conditions, like the ones listed in the middle of this page, can be diagnosed and treated based on symptoms alone. So many times you don't actually need to go in to a doctor's office or an urgent care and have a test done in order to be prescribed a medication to treat something. So for example, I always tell the story that I used a virtual visit recently for a sinus infection. My allergies had been pretty bad over the weeks before, so I got on the Teladoc app. Within a few minutes, I was video chatting with a doctor. He asked me some questions about my symptoms and ultimately agreed it was likely a sinus infection. So he sent a prescription for an antibiotic to my pharmacy, and I picked it up within the next hour. Super convenient, super low cost. Of course, you won't want to use a virtual visit for anything severe like a broken bone or a true emergency, but you can use it if you're not sure if you're experiencing an emergency. The doctors on the app can help you determine if you should go to the ER or not, so that could potentially save you a lot of money. This page of the guide gives some tips on how to be a good consumer of your healthcare, including understanding the difference between preventive and diagnostic visits, being aware of pharmacy discount programs, and choosing the right type of care. So when it comes to choosing the right type of care, it's important to realize that the emergency room is the most expensive place that you can receive care. And not only that, it is rarely the most appropriate place to go to get care. So the only time that you should think about going to the emergency room is if you're experiencing a true emergency. So for example, if you think you're having a heart attack, maybe you have a deep wound that needs treatment, or you're having a severe allergic reaction, those are great reasons to go to the emergency room. You should definitely go as soon as possible. But if you need medical care and what you're experiencing is not a true emergency, there are far better options out there that will save you time and money. So remember, you can use a virtual visit, or you can go see your primary doctor or visit a convenience care clinic in the event that you're experiencing something low grade. Urgent cares are also good options because they can do a lot of the same things that emergency rooms can do, but for a much lower overall cost. So different things like tests, scans, even stitches sometimes. Just some things to keep in mind on how you can be a good healthcare consumer and save yourself time and money. You'll continue to be offered the option of 2 dental plans, a DHMO plan and a PPO plan through United Healthcare. Under a PPO plan, the carrier, United Healthcare, pays a portion of the cost of your dental claims. So that amount is called coinsurance. And the amount that United Healthcare pays in coinsurance depends on whether the service you're incurring is considered preventive, basic, or major. In the middle of the page, it shows you some examples of covered services as well as their corresponding coinsurance categories. The carrier also has a maximum that they'll pay toward the cost of your dental services for each person that's enrolled in the plan. It's a $1,000 per person per policy year maximum. The plan pays a benefit at both in and out of network dentists, so keep in mind that you will pay more for services though if you go out of network. It is always best to stay in network. The DHMO plan, on the other hand, works very differently than the PPO plan. The DHMO plan works on a copay basis instead of by coinsurance. So each covered service has a corresponding copay amount, so you know exactly what you'd have to pay for each type of service. The copays under the plan are listed in the DHMO schedule of benefits, which you can get from your HR team. The network of dentists under this plan is also much more limited than under the PPO plan, so I want you to understand that as one of the major differences between the two plans. It's much more limited under the DHMO plan, and you're limited to only in-network services, unlike the PPO. The DHMO plan, on the other hand, does offer orthodontia coverage, whereas the PPO plan does not offer it whatsoever. So that is one of the major differences as well. So just to kind of summarize these two plans, if you're comfortable staying within the DHMO network, which you can find online, or you need orthodontia coverage, the DHMO plan is a great option for you. But if you prefer a wider network of dentists, or you go to a dentist that's out of network, the PPO plan would work best for you. Vision insurance is on the next page. So vision insurance helps subsidize the cost of glasses or contacts. So this is for those of us that do not have 20/20 vision naturally and we need corrective lenses to get us through life every day. If you visit an in-network provider, you'll pay a $10 copay for a routine vision exam, and then you can choose to use the plan for glasses or contacts. If you choose glasses, you'll pay a $25 copay for the lenses in those glasses, plus any additional copay if you decide to get lens enhancements. And you have a $130 allowance toward the cost of frames. If you get contacts from UHC's selection contact list, you'll pay a flat $25 copay, which will cover the fitting, evaluation, up to 4 boxes of contacts, and 2 follow-up visits. UHC's selection contact list is also known as their formulary contact list. In the middle of the page, it addresses how often you have these benefits covered under the plan. So you can get a covered eye exam and either lenses or contacts covered every 12 months, but the frame allowance you can only have every 24 months. The next benefits that we're going to talk about are the life insurance benefits. So your employer pays for a basic life insurance and accidental death and dismemberment policy on all employees. It's a $10,000 policy. It's through Mutual of Omaha. You will need to select beneficiaries in Employee Navigator if you've not done so already. So basically you need to let us know in the event that you were to pass away, where would you want that benefit going? Employees that want to supplement that basic life insurance policy can do so by purchasing voluntary life coverage. The coverage option amounts are listed on the table in the second half of this page. If you're a new hire electing this coverage for the first time, you can enroll in coverage of up to $80,000 for yourself, $25,000 for your spouse, and $10,000 for your children without answering any medical questions. So those amounts are what we call the guarantee issue or GI amounts. Your initial new hire enrollment is your one-time opportunity to get automatically approved for life insurance coverage. If you were to try to purchase life insurance outside of your employer, most carriers are going to require that you apply for that coverage, meaning that they can deny you based on how you answer those questions about your medical history. But when you're a new hire, this is kind of your one-time free pass to purchase life insurance and to not have to answer any medical questions. If you want to elect coverage over the guarantee issue amount, you can do so, but you would need to submit Mutual of Omaha's evidence of insurability form and get approved for the coverage before it would take effect. For all other employees that are past their new hire enrollment period, if you're enrolled in at least the minimum amount of coverage for yourself, meaning at least $10,000 for yourself, then during open enrollment you can increase that amount by $10,000 without answering any medical questions. If you're adding voluntary life coverage for the first time, or you're wanting to increase your election amount more than $10,000 or past the GI, you will have to submit the evidence of insurability form, and Mutual will have to approve you for the coverage before you start paying the new payroll deduction. Please be aware if you want to elect coverage for your dependents, you'll have to elect at least the equivalent amount in coverage for yourself, meaning you cannot elect more for your dependent than you have on yourself. The cost of coverage is based on your age and how much coverage you purchase. It's listed on the following page. So in order to figure out how much I would be paying for voluntary life on myself, I'd look at the first table on the page. The rates are age banded, so I would find the column where my age appears and go down to the coverage amount that I want to elect. For example, I'm 30, so let's say I want $80,000 worth of coverage. I'm going to look at the column for ages 30 to 34. I'm going to go down to the $80,000 row. It will cost me $1.68 per pay period. The amount that you would pay for coverage on your spouse is based on your age, not your spouse's age. So keep that in mind as you're looking at this page to see what you'd pay for those spouse-like deductions. So what I would do is look at the second table on this page. I'd find my age again from the columns, and then I'd go down to the coverage amount that I'm electing. The child life payroll deduction is underneath that. There's a flat payroll deduction for children regardless of the number of children that you're insuring. Meaning if I have 1 child or 10 children, I pay a flat 46-cent payroll deduction per pay period. Short-term disability is the next benefit we'll go over, and we like to think about disability insurance as paycheck protection. This is the policy that will continue to pay you a portion of your salary if you can't work because of an off-the-job injury or illness. Behind medical insurance, this is one of the most important benefits that you can have because it's the one that can make the difference in being able to put food on the table for your family if you can't work. Short-term disability starts paying on the 15th calendar day that you're unable to work because of an accident or illness. It can continue paying you 60% of your salary for up to 11 weeks past that. This is a voluntary policy, so you pay the cost of coverage if you want to enroll. During open enrollment, you can enroll without submitting an evidence of insurability form, meaning you're automatically approved for the coverage, but do be aware that there is a pre-existing condition on the policy. It's a 3-6 pre-existing condition, which means that if you're diagnosed with or being treated for a condition within the 3 months before your coverage is effective, and you're unable to work for a reason related to that condition within the first 6 months that you're on the plan, the claim will not be covered. You can calculate your cost of coverage by taking the premium factor listed in this page and multiplying it by your annual salary. That will give you your weekly payroll deduction. An employee assistance program through Mutual of Omaha is available to all employees and their families at no cost to the employee. We all go through things in life that causes stress. A lot of us are feeling particularly stressed right now because of everything going on in the world. So just remember, you have 24/7 access to over-the-phone counseling sessions with master's level counselors. The EAP also provides a ton of online resources for things like financial guidance, legal assistance, elder care, child care, and much, much more. This is a completely confidential service, so although it's paid for by your employer, they would never know that you called, much less what you called about. Lastly, you have the option of enrolling in 2 voluntary products through AFLAC. The first benefit is group accident insurance. AFLAC basically has established a dollar amount for all of the types of accidents that they cover on this plan. So if you're enrolled and you experience a covered accident and then you seek treatment for that accident, they will pay you the dollar amount associated with that accident. The key here is seeking treatment. If you don't seek treatment by a doctor, AFLAC isn't going to pay you anything for that accident. You can enroll yourself, your spouse, and your children under this policy. And of course, we all know that children have a tendency to get hurt, so if you have small kids, it's worth considering. The second benefit here is group critical illness. If you're enrolled in the critical illness policy at the time that you're diagnosed with a covered critical illness, including cancer, AFLAC will pay you a lump sum amount. You can choose the level of coverage that you enroll in. Those levels of coverage are listed on the following page along with the payroll deductions for each level. You can also purchase coverage for your spouse in addition to yourself, and then coverage for your dependent children is included at 50% of your election amount on yourself for no additional cost. Both of these policies include wellness benefits, so AFLAC will pay you cash for getting your wellness exam every year. If you're enrolled in one of these policies or both of these policies, it's worth getting a wellness exam by your primary care doctor since it's covered as preventive, and then submit a claim with AFLAC to get the money. To submit a claim, just reach out to Morgan at AFLAC. She's your AFLAC rep, and her contact information is on this page and the following page. And the next page also has those payroll deduction amounts for the critical illness policy as well. The next few pages give some government-required notices, so just keep in mind that these are here throughout the plan year should you need them. Finally, you have your important contact information listed on the last page of the benefit guide. You have the carrier phone numbers and website on the right side of the page, but more importantly, on the left side, you have the contact information for Melinda and HR. You can always reach out to Melinda and her team for your benefits-related questions, But we also encourage you to utilize the help of your Brown & Brown client care advocate, Trish Lay. Her contact information is listed on this page as well, under where it says Brown & Brown of Florida. We consider ourselves an extension of your HR department, so anytime you need help with your benefits, whether you're a new hire enrolling for the first time, or an employee that needs help filing a short-term disability claim, or needs us to research a complex claim issue, we're here to help. This concludes the presentation about your employee benefits. Thank you again for taking the time to watch, and please feel free to reach out to your HR team or Brown & Brown with any questions.